section will be on psychiatric exam and diagnosis for behavioral science and psychiatry for Falcon physician reviews. So the components of your mental status exam will be their general appearance and behavior. So what you'd be explaining would be, oh, this is let's explain me, for example. So I'm a young Indian female, attractive, beautiful, no, I'm just joking, but, you know, who has her hair down, wearing a white shirt, she's cooperative, she makes good eye contact, she's engaging, her speech is kind of fast sometimes, she has no abnormal movements noted. So those would be, you're trying to paint a picture of what I would look like. And then you'll go into their mood. So what did I say my mood was? So my mood is pretty good, so that would be what you would say for mood. And then my affect. So my affect would be what you see in me. So my affect is full range, meaning that I can go from feeling sad to happy appropriately and have a good range in my feelings. Then you'll go into perception. So you want to know if I have if I'm hearing any voices, if I'm seeing things, and I'm not. So you could say no auditory visual hallucinations. Want to look at my thought process. Am I logical? Am I goal-directed? Or am I loose and tangential? Am I getting off topic? Am I circumstantial? Do I have flight of ideas where I'm jumping rapidly from one topic to the other? So that's where you'll go with thought process. Then you'll go into thought content. And thought content will be delusions, any suicidal, homicidal ideations, any preoccupations, any obsessions, and you would want to elicit those in me. Then you would go into sensorium and intellect, and you'd want to see if I was alert and oriented ×3, if I had good attention, good concentration, if my memory was intact, how my abstraction was, what my intelligence was like. So that's what you would look at for sensorium and intellect. And then you would go into insight and judgment. You can formally test these things by judgment. You can ask the patient, if you found an envelope on the floor with an address and a stamp, what would you do with it? And if they said put it in a post office box, and that means they have good judgment. But some patients will say I'd open it up and read it. Well, that's not very good judgment. So you can formally test those things. And then also as you're doing your interview, you can tell whether or not a patient has judgment. And what insight means is that does the patient know that they really have this illness and this illness needs to be treated? And that can give you a sense of insight. Next we have the mini mental status exam. And this is a 30-point test, so to speak, that you can give to someone if you're concerned about cognitive impairment. And we generally use this for patients who have delirium, patients that we're trying to see have dementia. And how you do the mini mental status exam is that you will sit with the patient and you'll ask them the questions and you have them draw certain things for you. They have to fold certain tasks for you as well. Orientation actually takes up about 10 points of the mini mental status exam, just finding out what floor they're on, what county they're in, what today's date is, the day of the week, the season. So there's actually 10 questions just for orientation. Then you'll do registration and memory, which is for them to repeat 3 items and to repeat them back in a few minutes. You will check their attention and concentration. They can either spell world backwards or do serial 7s. They will have repetition where they have to repeat one phrase. And they'll have naming where they have to name a watch, a pen, etc. They have to follow a 3-step command. They have to write a sentence. And they have to copy a drawing. So if you have a mini mental status exam below 28, then you're going to start worrying about some kind of cognitive deficits. Now you also have to wonder, okay, what is the person's educational status? You know, is this normal? What did they miss the points on? Oh, did they miss the points on they thought today was Wednesday instead of Tuesday or the 26th or the 27th? Well, then you don't have to worry. But if you have a substantial decrease in your mini mental status exam and things that you think the patient should know, then you might want to start worrying about some cognitive changes that they might be undergoing. When you do your interview, you want to ask very open-ended questions. You don't want to ask very many closed-ended or directed questions because it might change the way that the patient will answer your questions. So on the exam, there'll be lots of questions where they'll say, what should you do next, or how should you proceed? And the best thing to do is to keep in mind to ask for to look for the most open-ended question. So the question in which you're not going to get a single-worded answer like, do you hear voices? Yes. Or, how many fingers am I holding up? 2. So those would be closed-ended questions. But an open-ended question would be like, how is your mood today? Oh, my mood, I'm feeling kind of depressed and sad. Or instead of, do you sleep at night? How are you sleeping? So you're looking for a more descriptive explanation. But when would you want to ask closed-ended questions? So an example would be if you're specifically asking, do you hear voices right now? Well, then it would be no. Or how many months have you been depressed? For 2 months. So those are the kinds of things that you can use closed-ended questions. So it's not that they're not appropriate in an interview, but you don't want to use them unless they're absolutely necessary. There are certain types of interviewing techniques. First, you want to gain rapport with the patient, and rapport basically means you want to gain some kind of relationship so the patient feels that they can open up and freely talk with you. In rapport, you will have support or empathy, which means that the doctor can see that you're in distress, and he can also understand how much distress you're in. Validation means that he continues to support you and he agrees with the feelings that you have. And reassurance is to let you know that yes, you're having a really hard right now, but things will get better. Next, you have techniques that will help you in gathering information, such as reassurance, facilitation, reflection, and silence. So facilitation will be to say something like, go on, which encourages the patient to keep talking because he feels that you're listening. Then you have reflection, which is basically you saying, well, Mr. So-and-so, what I think I heard you say was that you've been feeling really depressed and sad since your wife died. So you're just repeating and paraphrasing what the patient just said. So now that you've done your interview, you have to come up with some kind of DSM diagnosis. So the DSM diagnosis is split up into 5 axes. So the first axis is your major psychiatric illnesses. So your major psychiatric illnesses would be, for example, schizophrenia, major depressive disorder, alcohol dependence, ADHD, conduct disorder, learning disorder, anything like that can be on your axis 1. Now axis 2 will only have 2 things on them. So axis 2, 2 things. That will be mental retardation and personality disorders. That's it. Nothing else will go on axis 2. Then you have axis 3, which is your medical conditions. So this will be your high blood pressure, your diabetes. Say if someone just had a suicide attempt, you could put that on there, a motor vehicle accident, whatever it is, that goes on axis 3. Those are all your medical conditions. Then axis 4 is the stress. So what is causing these symptoms, or what is making these symptoms worse? Is it because you have no family support? Is it because you have no money? Is it because you just lost your job, your dog died, your wife died? So that's what axis 4 is these psychosocial stressors. Now you can either write the specific psychosocial stressors, or you can say that they're mild, moderate, or severe. It's really up to you. And then axis 5 is the Global Assessment of Functioning, or the GAF. And this is the number that's given to help identify at which level of functioning the patient is. So if you're functioning at 100, that means you're doing very well, you have no symptoms, there's no problems. Most people aren't at 100 because all of us have some kind of anxiety, some kind of worry that you're stressed out with in your life. So probably most normal people function around 80 or so. But say someone is very psychotic or very suicidal, well, they would be more around the number of 20. And say your normal outpatient who has a couple of symptoms lingering here and there would probably be between a 50 or a 60. This concludes our topic of diagnostic interviewing for behavioral science and psychiatry for Falcon Physician Reviews. This concludes our topic of diagnostic interviewing for behavioral science and psychiatry for Falcon Physician Reviews.